Hi, my name is Dr. Kareeshma Wadia, and today I'm going to be answering 7 frequently asked questions from patients who have to undergo cataract surgery. Question number 1. Is cataract surgery painful? Now, all surgeries are performed under anesthesia, which is a numbing agent. In cataract surgery, there are predominantly 2 types of anesthesia that the patient can have. One is what we call topical anesthesia. This anesthesia just involves drops and no injectables. That means there is no injection outside the eye. For this, the patient needs to be a little cooperative, look into the light and the direction that the doctor guides them to. In this surgery, the patient's pain sensations are completely numb, but they may have some awareness of pressure or touch onto the eye, which is why the doctor will keep talking to them during the procedure. Option number 2, this is called peribulbar anesthesia, which means the anesthesia is injected outside the eye. So it's not into the eyeball, but just outside the eyeball, between the eyeball and this bone over here, there is a space into which the needle is injected, and that causes the entire area to become completely numb. This is particularly useful for patients who are very anxious or scared, because the entire eyeball, blinking and eyelids, everything is out of control of the patient and is completely numb. The only downside to this is that the eye will be patched. That means there will be a putty on the eye, which may vary from a few hours to 1 day after the surgery. Eventually, the patch has to be removed and the doctor will examine you the next day. Question number 2. Is cataract surgery a major surgery? Now, cataract surgery is one of the most frequently performed surgeries. In India alone, per year, we have around 65 to 70 lakh individuals undergoing a cataract surgery. Modern day technology makes the current day cataract surgery far shorter than it used to be, and this makes the healing of the patient much quicker. But the expertise of the doctor is still required for you to experience your fabulous outcome after surgery. Question number 3. How long does it take to do a cataract surgery? Now, there is no race over here that we are trying to compete in, but on an average, a cataract surgery may range from 15 minutes to 30 minutes based on the surgeon's comfort level. Question number 4. What if you blink or move your eye during cataract surgery? Now, this is again one of the very commonly faced concerns from the patients. If you are undergoing an injectable anesthesia, your entire eyelid and this area of the eye is numb, which means it is out of your control. So whether you blink or not blink, A, you will not be able to feel it, and B, it will be under the control of the doctor. Point number 2. If you have chosen or your doctor has chosen topical anesthesia for you, which means that you will be using drops for the purpose of the surgery, before the surgery starts, we open the eye by using a small instrument called a speculum, so that your eyelids remain open and you are unable to blink during the surgery. What we require at the patient's end is just to ensure that they are able to keep their eyes open, because if you squeeze, it becomes difficult and puts pressure on the eye. Question number 5. Will I see things coming towards me during the cataract surgery? Now, when you are under the operating microscope, there is a bright light that is shone into your eyes. That light is so bright that mostly you will not be able to appreciate much. You will be able to understand that things are coming close by, but you may not be able to see details of it. Question number 6. Are you awake during the surgery? Absolutely, you will be wide awake during the surgery, but your eyes will be under the influence of anesthesia. Occasionally, the doctor may choose to give you a mild sedative in case he feels that you are a little anxious. Lastly, will the cataract surgery lens last you a lifetime? Yes, very much. It is meant to last for your entire life. Only in the case of maybe a trauma where the lens will get dislodged from its original place, it usually is going to be there for the rest of your life. Thank you for watching this video, and I hope you found it useful. If you have some questions, do leave them in the comment section.